In this video, we will talk about the parts of subclavian artery. First part of subclavian artery lies medial to the anterior scalene muscles. And what are the structures which are related to this part? The cervical pleura, the apex of lung, lies posteriorly to this part along with the trunk called as cervical sympathetic trunk. And what are the branches which are coming from this part of subclavian artery? Vertebral artery, internal thoracic artery, along with the trunk called as thyrocervical trunk. You can see here very clearly three branches are coming from the first part of subclavian artery: vertebral artery, internal thoracic artery, and a trunk called thyrocervical trunk. Now we will talk about the second part of subclavian artery. This part of subclavian artery lies posterior to the anterior scalene muscle and give rise of a trunk called costocervical trunk, which courses upward. You can see here costocervical trunk, which is coming from second part of subclavian artery. Now coming towards the third part of subclavian artery, which is also known as last part of subclavian artery, and it lies lateral to the anterior scalene muscle and gives off an important branch called as dorsoscapular artery. And dorsoscapular artery is a branch of third part of subclavian artery. This part of artery lies on first rib, also most superficial part of subclavian artery. As you can see here, dorsoscapular artery is a branch of third part of subclavian artery. Now you can see here, this part of artery lies on the first rib. Why it is important? Because the pulsation of subclavian artery can be felt by applying deep pressure in the omoclavicular triangle. We can felt the pulsation of subclavian artery. Here you can see the omoclavicular triangle. The pulsation of subclavian artery can be felt by applying deep pressure in omoclavicular triangle. And what are the relation of this part? Brachial plexus is related to this structure. Inferior trunk of brachial plexus lies posterior to this part of subclavian artery. You can see here, brachial plexus is related to this structure, and inferior trunk of brachial plexus lies posterior to this part of subclavian artery. You can see here very clearly inferior trunk of brachial plexus. Now we have to talk about the clinical anatomy of subclavian artery called as subclavian steal syndrome. In this condition, subclavian artery proximal to the origin of vertebral artery. As you can see here, this condition, subclavian artery proximal to the region of vertebral artery. As you can see here, subclavian artery proximal to the region of vertebral artery, which narrow or occlude due to the atherosclerosis. So this blockage results in lack of blood supply reaching to ipsilateral arm through subclavian artery, which can lead to reversal of blood flow in the affected side of vertebral artery. So the blood from contralateral side can flow through circle of villus to vertebral artery to affected arm. So this condition is mostly asymptomatic. If symptoms occur, mostly is the ischemia of affected arm, which lead to limb pain, fatigue, paresthesia, cold skin. Now talk about the neurological manifestation. It presents as dizziness, and syncope can also cause. Syncopes rarely occur, but it can be present in case of cerebrovascular lesion. Here is a characteristic diagnostic sign of subclavian steal syndrome, which is discrepancy in blood pressure between the arm, which is greater than 15 mm of mercury, because of the ipsilateral side of subclavian artery is occluded because of atherosclerosis. The blood pressure in the ipsilateral arm is gradually decreases. as compared to the contralateral side. On contralateral side, blood pressure is greater than 15 mm mercury than affected side. And on affected side, blood pressure is less than 15 mm mercury than contralateral side. This is the diagnostic sign of subclavian steal syndrome. And what about the imaging? Diagnostic of choice is ultrasonography, identify reversal of blood flow or atherosclerosis. And surgical procedure called as endovascular intervention surgery, which is used to treat the symptomatic case of subclavian steal syndrome. Thank you for watching this video.